Hello, and welcome. Today, we're diving deep into a specific type of heart disease, congenital aortic stenosis. This condition affects the aortic valve, one of the heart's crucial components, and understanding it is vital for both those affected and anyone interested in cardiovascular health. Congenital aortic stenosis, as the name suggests, is present at birth. It's caused by abnormalities that occur during the heart's development in the womb. While the exact cause remains unclear in many cases, it often results from malformation of the aortic valve leaflets. Instead of having three thin, flexible leaflets that open and close easily, the valve might have only one leaflet unicuspid, two leaflets bicuspid, or three thickened or fused leaflets. Genetic factors are thought to play a role, and it can sometimes be associated with other congenital heart defects. To understand the impact of aortic stenosis, we need to look at the heart's normal function. The aortic valve allows blood to flow from the left ventricle, the heart's main pumping chamber, into the aorta, the body's largest artery. With stenosis, the aortic valve is narrowed, obstructing blood flow. The heart then has to work harder to pump blood through the constricted opening. This increased workload can lead to thickening of the heart muscle, a condition called left ventricular hypertrophy. Over time, the heart can weaken and may eventually lead to heart failure. Congenital aortic stenosis affects approximately 3 to 6% of all children born with congenital heart defects. Bicuspid aortic valve, a common cause of aortic stenosis, is the most common congenital heart defect, affecting about 1–2% of the population. The severity of aortic stenosis varies widely, with some individuals experiencing mild narrowing that causes no significant problems, while others have severe stenosis that requires intervention early in life. It affects males more commonly than females. The signs and symptoms of congenital aortic stenosis vary depending on the severity of the narrowing. Mild cases may have no noticeable symptoms, especially in infants and young children. As the stenosis worsens, symptoms can include a heart murmur, detected during a physical exam. Children may experience fatigue, shortness of breath, especially during exercise or play. In severe cases, infants may have poor feeding, difficulty gaining weight, and exhibit signs of heart failure, such as rapid breathing and swelling. Older children and adults can have chest pains, have angina, dizziness, or fainting spells, particularly during physical activity. Diagnosis of congenital aortic stenosis typically begins with a physical examination where a doctor will listen for a heart murmur. The primary diagnostic tool is an echocardiogram, which uses sound waves to create images of the heart and its valves. This test can show the structure of the aortic valve, the degree of narrowing, and the function of the left ventricle. An electrocardiogram (ECG) can assess the heart's electrical activity, and a chest X-ray can show the size and shape of the heart. In some cases, a cardiac catheterization may be necessary to directly measure the pressure within the heart chambers and the aortic valve. Congenital aortic stenosis can be classified based on its location. Valvular stenosis is the most common, involving the aortic valve itself. Subvalvular stenosis occurs below the valve, often due to a membrane or band of tissue. Supravalvular stenosis, the least common type, involves narrowing of the aorta just above the valve. Treatment and management depend on the severity of the stenosis. Mild cases may only require regular monitoring with echocardiograms. Moderate to severe stenosis usually requires intervention. Balloon valvuloplasty is a procedure where a balloon is inflated within the narrowed valve to widen the opening. Surgical valve repair or replacement may be necessary, especially in cases with severe stenosis, or when valvuloplasty is not effective. Replacement valves can be mechanical or biological. Lifelong follow-up is essential, regardless of the treatment method, to monitor heart function and detect any complications. Because congenital aortic stenosis is a birth defect, there's no known way to directly prevent it. However, ensuring optimal prenatal care is essential. This includes avoiding alcohol and smoking during pregnancy, managing pre-existing health conditions like diabetes, and taking folic acid supplements. Genetic counseling may be beneficial for families with a history of congenital heart defects. The prognosis for individuals with congenital aortic stenosis varies widely depending on the severity of the condition and the effectiveness of treatment. With timely diagnosis and appropriate intervention, many patients can lead relatively normal lives. However, lifelong monitoring is crucial to detect and manage potential complications, such as heart failure, endocarditis, infection of the heart valves, and sudden cardiac arrest. Recent research focuses on improving valve replacement techniques, developing less invasive treatment options, and identifying genetic factors that contribute to the development of congenital heart defects. Transcatheter aortic valve replacement, AVR, a minimally invasive procedure initially used for acquired aortic stenosis in adults, is being explored in some cases for congenital aortic stenosis, holding promise for reducing the need for open, heart surgery in select patients. Further studies are needed to evaluate the long-term outcomes of this approach in younger patients.